I'm going to give you a few critical points about clinical labs and simulation sessions before this lab loses her attention span. Number 1, sit and study prior to the session. Review the objectives in the course syllabus, spending some time knowing what the outcomes of the session will be in advance and knowing what you're expected to learn with your teammates. If or when procedural skills are going to be covered and taught, you will want to review the anatomy in advance as well as the basics of completing informed consent prior to the procedure, which would include discussing the risks, benefits, alternatives, and the roles of team members in the procedure. And staying focused. You will also want to review the principles of aseptic sterile technique. 2, stay for the entire duration of the laboratory, just like this lab is trying to stay. 3, come to be engaged using an open mind and collaboration with your teammates to do your best in this scenario to get the best outcomes for the patient. 4, speak. And by that, we mean speak up. If you see something, say something. And that will apply when you're in the surgical suites after you've completed these simulation sessions. 5, play dead. No. The real reason we're in the simulation center is because we're playing Staying Alive, the song. That's the rate that we perform compressions and CPR. Our goal is to be effective team members and team leaders and to be efficient and effective with our communication so that we can ensure excellent outcomes. And if the patient is dying, as sometimes the engineers program into these scenarios, you'll need to think critically and act quickly to save the patient's life. Be clear and concise with your communication, and use the evidence-based protocols from basic and advanced life support training. 6, shake it off. Greet your colleagues at the start of the session. More importantly, be a good sport, on and off the field, as you have these friendly competitions in the simulation center. And, as our lab would say, shake it off, even at the end of the session. If it did not go as well as you thought it could have, the center staff and faculty will give you feedback and debrief the scenario with you, discussing what could have gone better next time in the spirit of continuous improvement. Clinical labs and simulation scenarios make for exciting learning and tremendous opportunities to better your clinical skill sets. Hit subscribe and share this video with your colleagues. Leave a comment. See you next time, and enjoy the lab. So much fun. I'm Dr. Chad Brands, and I'm going to give you a few critical points about clinical labs in simulation scenarios